and Jai Bhim all. My name's Dolly, and of course, you know, my intended population for this is basically my friends or my friends of friends, so you probably already know my name. Welcome to my kitchen. Essentially, you know, I don't even know how many of my friends know that I'm a PA. I work in internal medicine. I work in the hospital setting. Over the past year, I've worked majority in like field hospitals or COVID-only setting here in Boston. And in the past few years, I would say for like 3-4 years, I also run that kind of this telehealth setup where we see Dalit and Adivasi patients who are in rural parts of India. And for those of you who are unfamiliar, Dalit refers to the untouchables from the caste system, which is still an active thing in India, and Adivasis refers to the indigenous populations there who are amongst the most marginalized and oppressed peoples in India, both, you know, on all parameters, economically, health-wise, everything. And if you actually Google articles, you'll see a bunch of information about that. So I'm from the Dalit community, and I, you know, obviously we've been focused our efforts there because a lot of patients from the community don't have access to healthcare, or if they do, there's a lot of discrimination. It's very expensive for them. They're not treated well. They might not even get a physical exam. So in this small setup that we have, it's myself, Manoj, who kind of functions as like a frontline health worker. He is the one who receives the phone calls and speaks to people and kind of triages them and then sends it to our group. And besides myself, we have a friend of mine who's a hospitalist and then another friend of mine who's a nephrologist. So it's kind of a very small operation. We tend to pay for the patient's care, for their diagnostics and for their treatment, and whatever else that they need. We've been doing this out of pocket for many years. Over the past week though, we've had a lot of requests, about like 30 patients a day probably contacting us. And you know, all range, so COVID, non-COVID patients, a lot of folks who are stable but they're scared because they got COVID, they don't have access to hospital beds or oxygen. And you know, in the community in the US, there's a lot of folks who are trying to coordinate some of these larger things, but part of our focus is just to provide like basic medical care and follow up with patients. So, you know, first of all, $1 in the US translates to something like 60 rupees, which could be like the cost of an entire course of steroids that you need, or like cough medicine and then plus some, you know, sometimes maybe like a meal, like one-time meal. So, you know, money stretches far, which is why until now, like I've never had to do fundraising, but we're, you know, between pandemic and lockdown, asking folks to quarantine, there's no access to food, there's no way to earn money because a lot of the patients that we serve are daily wage earners. So it means that the money that they work for the day is how they run their families. And if they don't have that money, they're basically at edge. So, you know, I'm not trying to like run a nonprofit here. We don't even have a group for our name. So I just want to make an appeal to kind of the friends that I know who might be interested in supporting this kind of work. Any money that you give us will go 100% to any of the families that we work with. None of it is kept for anything, including any administrative charges or anything. We pay for all of that out of pocket. It goes direct to them. It's going to be used for oxygen, for food, for medical treatment. So if you have any interest in donating, you can consider donating to us. You know, there's also a lot of other resources going around. I would say please cross-check before you donate to organizations in India. Just like any major, you know, when you donate to something like UNICEF or whatever, there are huge administrative charges and people are getting paid to do this work. So, you know, at this point in the pandemic, it's just like what we really need is mutual aid. It's like the human to human connection. So if you have a skill that you're able to provide, it's just at this point, it's just humanity to kind of do that exchange without having to get paid for it, at least for folks like us who are out here. So yeah, that's all I wanted to share. I'm going to share the link to the Venmo account where you can transfer money. And please share this video if you feel like there are friends of yours that might want to help us do this work. And thank you so much.